Hello physios, I welcome you all to our channel Physiotherapy. We are back with our next lecture on thermotherapy. Okay, so here we are going to study about the therapeutic effects and uses of different methods of heating, that is the thermotherapy. Okay, so in this lecture I will explain you different therapeutic effects. Okay, so my name is Vijay Kumar and let's get started. First is tissue healing. Okay, so as we have explained in the physiological effect, due to heating there will be vasodilatation which will increase the blood. See what mechanism are involved. Vasodilatation, it will increase blood flow, then decrease viscosity, it will also increase the blood flow. Okay, these both things also metabolic activity, so these three things are helpful for the tissue healing. How? Because vasodilatation and reduction in viscosity help to increase the blood flow, and metabolic activity is increased, which means it will use oxygen, nutrition and various ions for the healing. Okay, so healing is improved. In what condition? Arthritis such as OA or RA, soft tissue lesions, okay, and post surgical healing. Okay, and what are the mechanism? OA में क्या होता है? Due to any kind of osteophyte, it cause irritation. Okay, and due to that irritation of the soft tissue there is injury and which is to be healed, and post surgical में भी हमें healing की जरूरत पड़ेगी. So this is about tissue healing. Next is relief of pain. इसमें हमने क्या पढ़ा था? पेन गेट थ्योरी. क्या पढ़ा था? पेन गेट थ्योरी. पेन गेट थ्योरी. ओके, सो क्रोनिक पेन के कंडीशन में क्या कर रहे थे? हम ब्लॉक कर रहे थे वाया गाबा. ओके, थर्मल क्यूटेनियस रिसेप्टर की स्टिमुलेशन से क्या हो रहा था? जो पेन पाथवे है वहां पर एक इंटरन्यूरॉन, दैट इज वाया इंटरन्यूरॉन गाबा इज प्रोड्यूस्ड व्हिच विल इनहिबिट द प्री एज वेल एज पोस्ट सिनेप्टिक ट्रांसमिशन. एंड व्हाट आर द कंडीशन? इट कैन बी ओस्टियोआर्थराइटिस और आरए or chronic low back pain. Next is chronic inflammation. See, it is important to understand that in acute condition, okay, whenever the inflammation cells are like mononuclear, okay, multinuclear, okay, so that is, it is the acute inflammation, that is injury is very, we can say, in the early phase. Okay, there we were using cold pack. But if the condition persists for a longer or the extended interval of time, as in sprained ankle joint, which means there was some ligamentous injury which has not healed yet, though it has undergone through the acute stage जा चुकी है, उसके बाद हमने क्या करना है? Here we will increase the blood flow by vasodilatation, which will increase the blood, which will help to increase the healing and reduce the inflammation. Okay, so inflammation को reduce करने के लिए हम यहाँ पर use करेंगे heating को. Then reduction of chronic muscle spasm. Okay, जैसे कि मैंने muscle tone में बात की थी, किसकी बात की थी मैंने? मसल टोन में स्पास्टिसिटी की बात की थी अपर मोटर न्यूरॉन लीजन के चलते. यहां पर भी अगर कोई भी क्रॉनिक मसल स्पाज्म है, इट कैन ऑल्सो बी रिड्यूस्ड बाय हीटिंग. एंड इसका मैकेनिज्म क्या है? इट हेल्प टू, दैट इज हीटिंग रिड्यूस इस्चीमिया. ओके, अब इसमें भी इट इज इंपॉर्टेंट टू अंडरस्टैंड how cold and hot are being differentiated. For example, there is an muscle spasm due to any injury. Okay, what is muscle spasm? It is the protective shortening of the muscle which is producing pain. In acute condition we were applying cold pack, but if this spasm is present for a extended interval of time, that is the muscle is in the contracted state for a longer interval of time, it may develop some ischemia, and due to this we can apply heating to that body part, or that in that case to reduce the ischemia so as to increase the blood flow and reduce the spasm. So you need to understand that where in spasm you need cold pack and where in spasm you need hot pack. Similarly in case of inflammation, okay, and healing also, okay. So you need to understand the differences, okay. Next is sedative effect. It is very simple to understand. You know, it will help to promote the sleep and give the general relaxation and reduces the BP also. It helps to decrease the blood pressure. Why? Because whenever we are having heating, there will be vasodilatation, also there can be some sort of sweating, which will help to reduce the blood pressure, which will having a sedative effect. So in relaxation therapy also we can add it. So increase the joint range of motion. Due to any kind of post-operative stiffness, there is collagen tissue formation, and if it is not in a proper alignment, there can be a lot of stiffness, and to reduce that stiffness, that is to promote the proper alignment and extensibility, okay. Extensibility, we can use the heating modality, okay. Extensibility increase. Also it can be used in contractures when are in the early stage. Infection, yes, bacterial and fungal infection. In both the condition we can use heating. Why? Because whenever we are giving heat, it will increase the blood flow, so will increase the WBC at the site where hot pack is applied. So as WBC concentration will increase, it will fight against these mighty bacteria or any kind of fungi which are producing the infection, okay. And last is as a precursor to other treatment. Yes, before stretching we can use it, before massage we can use it to increase the motility of skin, before mobilization also to increase the mobility of skin, then for traction and relaxation. So it can be a good precursor for various treatment. Although these all things are different treatments, but if we are applying heat therapy before these things, definitely there will be a much better effect than by the single therapy use, okay. So this is all about the therapeutic effect, okay, which is tissue healing, relief of pain, chronic inflammation, spasm, chronic, okay, I have written in bracket, then range of motion, sedative, infection and precursor, okay. So these are all the things you need to understand, and you can compare these things with the explanation of cryotherapy. So you have a proper differentiation and proper mindset that whether your patient is needing a cold pack or hot pack, okay. So you need to judge it according to the history and the chief complaints given by the patient, along with the various aspects of examination, okay. So in our next lecture we will study about the different modalities which are used in the heating, okay. So till then you keep on studying. Thank you to one and all.